Hello, everyone, and thank you for joining today's webinar on Understanding Care Management Requirements and Medicaid Status Impact Regarding HCBS Eligible Children. Before we get started, I'm going to run through just a few quick logistics. The slides and the recording for this webinar will be posted, so you will be able to access them at the CTAC website following this webinar. Additionally, we are planning to have time for Q&A at the end of the webinar, so please submit your questions throughout. Please submit them via the chat box on the right-hand side of your screen. If the chat is not already visible, you can access it by clicking the little thought bubble on the bottom toolbar of your screen. And please be sure to send all of your questions to the host. And with that, I'm going to turn it over to the Department of Health, who is going to be our presenters today. Thank you.
Great. Welcome, everybody. This is Colette Pullen with the Department of Health, and I have a number of other folks here from the Department of Health that will be joining us in the presentation and answering questions, and I'll let them introduce themselves.
Hi, I'm Wendy Butts. I'm with the Medicaid eligibility.
Hi, I'm Hope Goldhaber. I'm with Managed Care.
Great. And we have some other folks here as well that will assist us.
Hey, Andrew Kuchek here.
So last week we sent out two pieces of guidance that are really, I would say, weaved together. But when we had written it as one document, it seemed very long and confusing. And we wanted to segregate out the specific issues. So one of the guidance documents that went out last week was HCBS Waiver Eligibility Service Requirements, and then Medicaid Eligibility Status Impact on HCBS Eligibility for Children. So our goal today is really to hit the highlights of these two guidance documents and then be able to answer questions. We did send out the slide deck to the Health Home listserv. So for those of you who are signed up on the Health Home listserv, and then MCTAC will be posting the slide deck as well as the recording. Depending on the number of questions, we also plan to do an FAQ if that's needed to clarify anything that is not clear in the presentation nor in the guidance. So feel free to ask your questions. Our goal was to really try to answer a lot of questions we've been receiving in the last couple months due to HCBS and the various authorities. So the first piece, and we did separate the webinar into the two separate guidances, and then we'll talk about how they work together. So the first part is we are going to talk about the children's waiver and just give you a little bit of an overview. So as I mentioned, those two guidance documents that were sent out last week was to clarify and give direction to our care managers, CS, and of course our managed care plan care managers. And we put in these two boxes here to kind of outline what the purpose of the two guidance documents are. And the first one for eligibility of service requirements is really to make sure that everybody understands what a child who is HCBS eligible and enrolled, what needs to happen for them, their HCBS eligibility determination, that they need to be connected to an HCBS service, what happens if they get in a restricted setting, and then just making sure that those children are connected properly. And then, of course, children need to be in Medicaid to receive these services. And children can get Medicaid in all kinds of ways, right, based on their local Department of Social Services and working with them and how eligibility can be determined. And in August, as the guidance document mentioned, in August, we received CMS approval from our 1115. And this is very specific to our family of one children who receive that Medicaid eligibility because they are waiver eligible. And so we'll go through that in the guidance document and in the slide deck. We have a flow chart that we hope makes folks understand, and also for you visual learners, it will be helpful. And then we want to highlight where this information is posted. And so if you have never seen this web page before, then you're missing out greatly on a lot of information. This is where we're putting everything specific to the waiver, guidance documents, about modifications, about how to work with OPWDD. So there's lots of tabs with information. And these two guidance documents are also posted here. So you can hit that website link at the top. And then both of these titles here are the link to the actual document. So you can feel free to also go there, or you can click right on the document. So we tried to make sure you could get to these documents if you had not seen them, or if you lost them in your mailbox, that you were able to get to them. So the first piece of guidance that we issued was specific around HCBS eligibility and the service requirements, and this is really for care managers, whether you're with CS, the managed care plan, or health home. And I think most of you know this, but in April 1st of this year, we consolidated those 6 home and community-based waivers. I'm sure you've seen the slide many times that had the OPWDD care at home, the OMH SED, the DOH care at home 1 and 2, and then our OCFS had 3 waivers, the Bridges to Health for the DD foster care population, the SED, and the Med-Frag. So we combined those all into one waiver, which is now called the Children's Waiver. Now, what we had to do is when we combined these waivers, each waiver had little nuances and differences, and so we needed to make sure there was one standard. The other thing that we worked here really at the state, with our state partners and within the Department of Health, is to try to streamline some processes, clarify how eligibility could be made. Anything that we had heard from stakeholders that were problematic or were stopgaps to services, we tried our very best to address. And so we want to make sure that if you were a previous waiver provider, that you understand that now things may have changed. And so we've been receiving different questions, and so we've been trying to share that information out in this document. These guidance documents also help with that. At the same time, consolidating all the waivers, there was a small number of waiver providers, I think about 84 or so. And now that the health home program is directly connected to the children's waiver, we have increased the number of care managers quite a bit. So now we need to educate all kinds of care managers out there. What does the waiver mean? What does the services mean? How do you get those types of services? What are the rules? So this is another reason why we needed to do this. And of course, we increased the number of services. Even though you may feel like the services haven't increased, each waiver had a set of services. And if you wanted a different type of service from another waiver, you had to move to that other waiver and be eligible. Now, if you're eligible for the children's waiver, you have the whole suite of services available to you based on need. So we believe that's an increase of access, an increase in number of services. And then also eligibility now for the waiver to have a child or youth eligible, only care managers and CES can conduct that HCBS eligibility, where waivers may have had the SPOA or the local Department of Social Services with maybe nurses that did eligibility. Now we have streamlined that into health home care manager or CES. So we just wanted to make sure that people understand that we're just highlighting what is the requirements now for the waiver, the children's waiver, and what some key points are that we heard, and making sure. So level of care, which is the HCBS eligibility determination, is valid for 1 year. That was with all previous 6 waivers. It was required that an annual redetermination was done, and it's 365 days for those of you who want. You need an active annual HCBS eligibility redetermination to continue to have your child or youth remain in the waiver. Now, for those children who transitioned, we have given some extensions and we have given some recent guidance. So every child in the children's waiver by November 30th, 2019 must have an active LOC. And if you're not sure what that means, you need to call your health home or here at the Department of Health and we will help you. So there's all kinds of information and guidance out on our website. So every child in waiver must have an active LOC, and they have to be eligible. And as we mentioned, health home care managers or CES are required to complete the new HCBS LOC eligibility determination. And we recently also put guidance out that that can begin 2 months prior to the due date. So we heard from a lot of folks that the due date had come and passed, but they were still collecting paperwork or information. And so for those of you who might not have worked in waiver before, you should really start eligibility determination by gathering the necessary paperwork, working with your care team, getting things signed off on at least a minimum of 2 months prior. And so as a care manager and CES staff, you need to know what all the requirements are in the paperwork. And then as you become familiar with that, then you'll know how long things may take. So we've received a lot of questions about what do we do if a child goes into a hospital or what we call an HCBS restricted setting. So if they go into a residential facility, a nursing home, those types of things, do we discharge kids from HCBS? No, please do not discharge kids from HCBS, the waiver services. So in each of the previous waivers had a different time frame of how long they could leave a child in the waiver before they had to discharge them. So the children's waiver gives the maximum amount of time. So I know like the Care at Home program used to give 30 days. So the children's waiver allows a child who is HCBS waiver eligible and enrolled, if they go into a restricted setting, to be there for up to 90 days. So that's really important. Do not discharge those children, okay, for continuity of care. So if the child is being served by the health home, there's lots of guidance already out for health homes when someone goes into a restricted setting, and the link there to the continuity of care policy is there. If the child's in health home, you're going to do what we call pen the segment in MAP. So that's important. You're just basically putting the case on hold, so you're not discharging. And whether the child is with health home or the HCBS providers, there's no billing while the child is in that placement. Now, care management may be able to bill, and I will reflect you back to that policy about how you can bill, but the HCBS services should not be billed for because the child wouldn't be receiving those services. And of course, the care manager, whoever that may be, whether that's health home, CS, or the managed care plan, should notify the care team that the child was placed in a placement and have that discussion of what needs to happen when and if the child returns from that placement. And then you really want to be in contact with that hospital or residential or nursing home, wherever that child was placed, to find out what their thoughts are about discharge planning. And you want to be notified 30 days or as soon as possible, if the length of stay is shorter, when that child's going to be discharged, because you want to participate in that discharge planning and make sure that they can get reconnected back to the waiver services. So in the guidance document in here, we say what you need to do if it's shorter than 90 days or shorter or longer than 90 days. So as I just mentioned, if it's shorter than 90 days, the child should remain in the waiver services. It's a requirement as a significant life event that a new LOC will have to be completed. So as a health home care manager, CES, you would want to be working with that facility, know when the child might be discharged, the potential date for discharge, and you want to be, helping with that discharge planning and conducting the HCBS eligibility. This should be relatively easy in the sense that if a child's in a facility, then you would have the appropriate licensed practitioner of the healing arts to sign your LPHA attestation. They would be able to give you any diagnosis or issue of why the child was placed. So some of that information, or most of it, could be coming directly from the facility where the child is placed. Now, if the child is going to stay longer than 90 days, then at the 90 days or 91 days, you will have to discharge that child from the waiver services. I'm being very specific about HCBS waiver, because in health home you may be able to keep that child in the health home, so please look at that policy. You're going to discharge them and do your proper notice of decision as outlined in the policies. And you need to know that any child who has Medicaid family of one, that they may be losing their Medicaid because they've been discharged from the waiver services. It's important you share with the care team and everyone that you're discharging the child or the youth based on their placement. You also want to make sure that restricted setting calls you back if the child ends up getting discharged and is in need of HCBS, because there's nothing preventing you as a care manager from reaching back out to that hospital in 180 days whenever they give you a call, and then you could do a new HCBS eligibility and then help and assist with discharge to re-enroll them. So there's nothing prohibiting you from doing that after the fact of 90 days discharge. So what's really important for folks to understand is that any child who meets HCBS eligibility, that means they meet the target, the risk, and the functional criteria, and in the UAS for the HCBS eligibility determination, there's a big yes, they are eligible for the waiver there. You have obtained a slot from capacity management, right? So that's really important, because we're the ones that are putting up that wonderful K code so people can bill and get paid. So after you have all of that, it's imperative and a requirement that the child must receive at least one HCBS service on a monthly basis. So that is a requirement of the waiver. It's a federal requirement. So it's really important that when you are making your assessments and working with the family and you're determining their strengths and needs and you're working towards that plan of care, that you are making sure that the child is connected to at least one HCBS service and a service provider that is designated, right, to provide a service. And we just recently did our workflow, a plan of care workflow of how you would refer to those services. And then, of course, based on choice and the needs that the family has identified, you'll develop that plan of care. And, of course, you don't have to limit yourself to just HCBS services. You can anything that the child may need, any type of Medicaid services, whether it's behavioral health or medical, you want to connect that child appropriately to make sure that they are having their needs met. And, of course, you want this to be supportive to what you have identified as their needs, and you must document this right in the case record, which I'm sure all of you are aware, and your plan of care will have those items on there. So as I mentioned, at least one HCBS must be received monthly for that child to be eligible. So we have received a number of emails and calls saying if the child's not going to the program or not attending the service, or the family keeps missing the appointments, what are we supposed to do? So that's where you need to have a discussion, right? So you want to make sure that the family understands that you've identified your child as a high needs child. They're eligible for this high needs service of HCBS, and it's a requirement of the program that they have a monthly service. And that if they continue to miss the appointments and not receive the services, then you and the care team and the family need to have a discussion about whether or not that service is needed and important to that family to be able to attend. And you need to be documenting your efforts to get the family to those appointments. and making sure that you're documenting how you're trying to meet with them on a monthly basis as a care manager, as well as for those HCBS services. And then I would say that we put here out in policy that quarterly you really need to, so if they miss 3 months in a row, you really need to start talking about termination, discharging. Do you need to maybe change who the provider is? Like, is the service just not working? Is the time not working for the family? What is the barrier for them to receive that regular service? As I mentioned, it's a requirement that they receive one HCBS on a monthly basis, so you cannot just continue not to receive the service. But we also don't want you to immediately discharge, right? So someone misses an appointment in 1 month, you don't want to discharge them, right? These are high needs kids, and we want to make sure they have the right fit to the right services. So you really need to have that quarterly review and have a discussion with the family and the care team about what the barriers are for them attending the appointment or the service, and is it the right fit for that child. And if it's not going to work, then you may want to change services, change providers, or are there other needs that need to be addressed first? And does that impact their waiver eligibility, and do you need to terminate or change what is happening? The other thing is we want to make sure that, we've been through this transition phase, and we have heard that there's accessibility issues. So we've heard from a lot of folks that they may be struggling to connect a child and that kids are on wait lists. So I just must stress for everyone that it's a federal requirement that if a child is eligible and enrolled in HCBS, that they have to have that monthly service, and they can't just be put on a wait list. Now, they can be put on a wait list if they're receiving one service, but the other 2 services they might be on a wait list for, but they can't be on a wait list for all their HCBS services. So what do you do if you're running up against this? So the first thing is you want to, review the services in your community that are available. You, as a care manager, you're going to need to call those providers and say you have a kid that's waiting and you need to connect them. So that's very important. The second thing is you should call their managed care plan if they're in a plan. So maybe that plan can also assist you because they have contracts with lots of providers, and maybe they can steer you in a way or try to assist you. It will also alert the managed care plan that there may be an access issue in that community. Any effort that you are making to connect that child should be obviously documented and properly. For health home, you want to call the health home and talk with them. Maybe the health home can assist you. And then, of course, we're asking the health home to alert DOH and the managed care plans if there are access issues. So through this transition, I just want to highlight that although we opened up services, so to speak, this is a lot for different providers. Different providers have been designated or de-designated. People are trying to accommodate the different changes in qualifications and things. We also know that a number of children who were in the previous 6 waivers may have stayed in the waivers and also went to the new Children and Family Treatment and Support Services. So they may be taking up services in both SPA services and HCBS, which is totally allowable. But what we want to do is try to really connect kids to the right service and make sure that everyone who needs services can get connected. So we are definitely working with stakeholders and providers to see what we can do to build capacity. In the meantime, though, we still have this requirement that children who are HCBS have to have an access to at least one service. So we want to make sure that all care managers should be evaluating and reviewing their HCBS children for their plans of care and matching them as best as possible to services. And then also looking if they're getting all their needs met in a state plan service like Children and Family Treatment Support Services or CFCO, that if their needs are getting met there, then maybe they should be disenrolled from the children's waiver. And of course, Medicaid status may play a part in all of that. So the second part of this presentation will address that. But we want to make sure that kids are matched, and we want to make sure that if they don't need the service, they don't want the service, they're not utilizing the service, then they should be disenrolled, not just taking a slot or a spot where a child on a wait list might be able to get that service, because we want to try to open these services up. So this transition period, I think, has been a little difficult, and so we need to start evaluating children and youth plans of care and making sure that they're matched to the right services, and if services are being utilized that are meeting the needs, then maybe other services need to be discontinued.
So Colette, could I jump in for a second? I think this is Hope, and I just want to point out here is that we're not talking about removing services from any child that needs a service. What we're talking about is administratively ensuring that that child is in the right place to receive the services that they need. So if a child really needs state plan services like private duty nursing, and they need CFTSS services, which is also a state plan service, they don't really need to be in the waiver anymore. And that's one of the best things about this new children's design, is that you don't need to go through extra assessments, extra hoops, be in a waiver just to get access to the most used services that children are accessing. So we really want to make sure, now that we've transitioned our children through this sequence over the past year, that we now have these children in the right place for the services that that child needs. And by pulling a child off the waiver, they only need state plan services. They're not accessing any of the HCBS services. They don't have to fill out that extra paperwork. They don't have to go through that loop. You know, if that child can be served in state plan, community Medicaid, with CFTSS, that opens up that other slot for somebody who might be waiting in the wings and is trying to access these services. And that's what we're talking about when we're saying, you know, really make sure that children are connected to the services that they actually need and are not just sort of lingering in the waiver because they were in the waiver before and that's what they're used to. Is that fair?
Yeah, great. So the second piece of guidance that we issued was specific about Medicaid eligibility and how it impacts HCBS. So this is important, again, because we combined the waivers, and every waiver had a little nuance to it. And so we just want to highlight that not that the authorities are necessarily important to you, but our 1950C combined the 6 waivers, or consolidated those 6 waivers, and then as we mentioned, in August of this year, we got our 1115, which addressed the family of 1 budgeting, and so an ADM and other things have gone out to address that, because our goal here was to make sure that the 6 waivers and those children had continuity of care when they moved to the transition to the children's waiver, and we wanted some flexibility on how to access services and an easier way for children to get on Medicaid if they needed HCBS services. And so the first thing is, and I hope everybody knows this, but for HCBS eligibility, as I mentioned already, the children's waiver, only CES or the health home care manager can determine eligibility. And all children who are in the waiver need care coordination, and we've connected that to health home for that comprehensive care management. And I also want to just highlight that bullet in the middle, that if a kid or a youth is found eligible for the waiver, they are automatically health home eligible. So we recently got some emails asking if you need to do health home eligibility on top of the HCBS eligibility, and the answer is no. Now, if a kid comes through the door through the health home first and they're health home eligible and you're serving them and then they need HCBS, you would need to do the HCBS eligibility. But if the referral comes to the health home directly that they need HCBS, and if you conduct the HCBS assessment and they're eligible, then they're automatically eligible for health home. Of course, anyone can opt out of health home because it's an optional benefit. And, you know, so we've said this a lot also, is that if somebody opts out of health home, then they would go to CES, right, our independent entity, who will service them. And if they're also in managed care, then the managed care plan will assist in coordinating their care for HCBS. So CES is the one that helps and assists with eligibility, and then will also assist with the establishing of Medicaid eligibility, gathering that paperwork with the family to get that to the local department. And then if they're in managed care or fee-for-service, that will determine how their care coordination will continue forward. And of course, all of this is done by a person-centered approach where the family has choice of who their providers are, regardless of where they started. So if they started with CES because they needed to get on Medicaid or needed assistance with Medicaid, they can always then either stay with CES or then be transferred over to health home. So I'm going to turn this I'm going to transfer over to Wendy, who's going to go over a family of one Medicaid eligibility.
All right. Good afternoon, everyone. And we're certainly not trying to make anyone a Medicaid eligibility expert with all this information about Medicaid eligibility, but I do think it's important to understand a couple of different aspects of Medicaid eligibility that may impact you and your role, like what's needed on a Medicaid application for a new consumer, and the connection between the receipt of certain services to Medicaid eligibility, because it will help in understanding your role and how it relates to eligibility. So family of one and Medicaid eligibility. This is a method of determining financial Medicaid eligibility for a child that's unique to children in the waiver. And it's a term that's used to describe a method for determining eligibility that's very similar to how we determine eligibility for a child who's institutionalized. So it's institutional eligibility. And basically, if a child is not otherwise eligible for Medicaid, I'm going to call it under regular Medicaid eligibility rules, where you have to look at parental income, perhaps resources, income of other children in the family, and you determine eligibility basically based on the household. If that child's not eligible, this family of one eligibility basically allows us to determine eligibility just for the child based on their own income and in some instances resources, without regard to parental income and resources. And it basically mirrors how eligibility would be determined if that children, in fact, had to be out of the household and institutionalized. The waiver allows us to not only provide certain services to this population, but it also allows us to apply unique eligibility rules in determining that child's eligibility so that the child can stay at home in a community setting and not have to be institutionalized. So when a child is determined eligible for the waiver based on HCBS and level of care eligibility, and there's a slot available, that's when, if a child not otherwise Medicaid eligibility is entitled to have eligibility determined under our family of one budgeting. And as Colette referenced earlier, you can identify when that has happened based on a KK code that will be apparent on e-PACES when you check eligibility, and that's a restriction recipient code, RRE code, and it's KK, and it means that that child's had eligibility determined under family of one. Another thing to mention is, as you are required to do an annual eligibility determination for HCBS criteria or recertification, you do not need to send that to the local district any longer. The districts, once that they know a child has been approved for the waiver and there is a slot available, they will continue to consider that child to be a waiver participant until they're told they're not participating in the waiver anymore. So they don't need that annual recertification.
So I think the point we're trying to make there is that once that child is up on the waiver, the communications then are happening from the state to the district if a child's status changes. So the care manager should be just following the policies as written, where you're notifying capacity management of those changes, and then the state takes over from there to update the district as necessary.
Okay,
Right, which is a definite change.
Right. Okay, that's good clarification. So how we determine Medicaid eligibility, and this is a change potentially depending on what waiver you may have had experience with in the past. And it basically stems from many, many conversations we had with CMS to get our 1115 waiver approved. But basically, in determining Medicaid eligibility, we have to start with determining eligibility for that child based on regular eligibility rules, meaning we need to count that child in with the rest of their family and determine whether or not they're eligible with their family. So we do need on the Medicaid application income information for the family members, parental income information. We are not requiring documentation of that income information, but we are requiring that the parental information be included on that application. If a child's in a medically fragile diagnostic group or they're already certified disabled, we're also asking for resource information, not documentation, but information. That's because a child who's certified disabled does have a resource test, whereas non-disabled children do not. If a child's in a medically fragile diagnostic group, we are going to, if the child's not eligible as a family member by counting parental income information, we're going to have that child go down the path of having a disability determination made if one has not been made already. And if there's a high likelihood that that child will be found certified disabled, and we will need to have that resource information for that disabled eligibility determination. So that's why if the child's in a medically fragile diagnostic group, we are asking for parental resource information to be included on that application. We're also asking for income information for children or siblings of the waiver child under age 18. And that is because when we do Medicaid eligibility determination by counting the family income, we go through a process called allocation and deeming, and we may set aside parental income for non-disabled children under 18, but that set aside gets offset with any income that child may have of his or her own. So that's why we're asking for any income information of siblings under 18. So as I indicated, we will follow the path of a disability determination for a child who's in a medically fragile diagnostic group. And just to make a long story short, the reason for that is basically the authority under which that child would then be Medicaid eligible if they end up having to be a family of one eligibility determination. And that authority, if you're certified disabled, would fall under the 1915C authority. And that's where we need to have that child placed, if at all possible, and only as a last resort are we to use the new authority under our 1115 to allow family of one budgeting for non-disabled children. So that's why we're still going through this disability determination for medically fragile children. and it's strictly tied to financial Medicaid eligibility and the authority under which we then have that child be eligible, and how we have to basically count that child under our 1115 waiver or 1915C waiver. Pending that disability determination, however, we don't want to hold up any financial eligibility determination for children. So we did authorize the districts to go ahead and determine Medicaid eligibility based on a non-disabled budget, family of one, if that's what's necessary, pending that disability determination outcome. So a child should not have to wait for the eligibility determination based on the sole purpose of that disability determination. Once the disability determination does come through, for us it'll just change some coding that we put on our system in order to track the child.
So I think, one, this is a change for like our care at home population, DOH care at home population that had to be disabled prior to getting on the waiver. And this is also a good thing, as Wendy just mentioned, because we're not waiting for that disability determination to be made. So children can become Medicaid eligible quicker in the sense to get that family of one eligibility, and then also get into the waiver sooner. So although this may be a change, we feel like this is a streamlined process to move a child into services quicker. And so I just want to share on this slide, because we received a lot of questions. And again, I think this is a change from previous waivers, is we allow for the target population, the med-frag target population, that you can have one of these three things, either a current SSI certification, or you already have the disability determination or certificate, or, which is a change, is you could complete, you as a care manager with the family, complete these three forms, one's for the school, one's for the doctor, et cetera, and have it reviewed by the licensed practitioner of the healing arts, and that would make someone potentially eligible for HCBS. That does not alone make someone eligible for family of one, okay? So what Wendy just went over was how to become Medicaid eligible, and these forms assist in how to become eligible for HCBS. These forms, however, that you complete when the local Department of Social Services sends out to the family information that they need to, go forward with the process of the disability determination. If these forms have already been completed, then you can share these forms with the family. You could assist the family get the other paperwork together so that packet can go together and that child can be determined, get that disability determination. But as we mentioned, Medicaid should not be held up, and you should be able to get into the waiver services. And there's nothing a care manager needs to do separately than to assist the family. So in previous waivers, you may have collected documentation and sent it to the disability review team here at DOH. You don't need to do that. That is the responsibility of the local departments of social services, unless, of course, the family is pursuing SSI and you want to assist them with that. But again, the care manager's role is to assist the family in gathering the proper documents. So we just want to highlight really clearly that these three forms are for HCBS eligibility determination versus what Wendy just went through regarding family of one Medicaid eligibility.
Right, and I'll just clarify that if somebody's on SSI or already has a disability certificate, we are not going to do that process again. We would have that information. So what I went through is really pursuing a certification of disability for a child who has not been found certified disabled yet.
That's a good point.
And in addition to the districts, It's in many cases, it's actually our state disability review team that would get notified of a disability determination that was needed for a child in the waiver. They are now also actively working with families to gather the documentation that's necessary in order to complete that disability determination. So they as well will be reaching out to families regarding the completion of certain forms that they may need. Certainly if those forms are made available to the family to be able to submit when requested, that would help expedite the process, but if not, that's okay, and the disability review team will certainly reach out and gather the information that's necessary to make that determination. So I think on this slide, we're emphasizing that a family of one child can also receive any other Medicaid services that are covered under the state plan, private duty nursing, children and family treatment and support services. They do have to be receiving, though, a waivered service or case management. Did I say that right?
So, yeah. And
in order to be in the waiver, and I just want to emphasize, this is a circumstance where if they're not in the waiver and they're a family of one child, they may not otherwise qualify for Medicaid. Their income or resources may be too high, or that may have such a high spend down that they won't be able to meet it. So that's where you'll often see a difference with family of one children. Their connection to Medicaid eligibility is oftentimes directly connected to their being a participant in the waiver, being in receipt of a waivered service. So there is much more of a stronger connection between the services they're receiving under the waiver and their eligibility outcome than there is for children who are what we refer to as community eligible. And those are children that are eligible under regular rules by counting family income or resources, if that's the case, and it's not connected to their participation in the waiver. Anything else to emphasize?
No, because I think in the next couple of slides we're going to go through this again. We're going to say it a couple of different ways just so that folks can really internalize what we're trying to get across here. And there's those 2 points, right? A family of one child must be in receipt of monthly HCBS to stay in the waiver to retain their Medicaid eligibility, or, you know, they may be subject to that very large spend down that they're not able to meet. And then, however, how they meet that requirement, there's a couple of different pathways, right? They have the monthly HCBS, or they have health home care management, and I think that's what Colette's going to get into.
Great. So we're just reflecting again, it does not matter if the child is community eligible or family of one, as we keep saying, if they're in the waiver and enrolled, they need to have that one service, and they need to obviously have a plan of care and have those services be supportive to their needs and documented in the care record based on your assessments. And what we're saying here, what the August authority of the 1115 gave us is that a family of one child still has to have that monthly HCBS requirement, but now health home care management services can act or count or whatever the word is you want to use as meeting that monthly HCBS, and this is only for family of one. So in some of the previous waivers, this was specifically the care at home, because of maybe the number of services or the lack of HCBS services or the needs of that population, they were allowed to get only case management. So we wanted to make sure that that category of children were still able to access HCBS, And so, as we just mentioned, any family of one. So first you need to become HCBS eligible, right? And as Wendy mentioned, many of the family of one budgeting is connected to someone becoming first eligible for the waiver. And then obviously you want to try to connect a child and their needs to an HCBS service. And if they can't do that, then they could have care management only as their sole HCBS service, and then that would meet the one HCBS service a month that is required. And the only care management that would qualify for this is Health Home Comprehensive Care Management, and it would require a face-to-face contact on a monthly basis, regardless of acuity level, because acuity of low does not require in the Health Home Program or HCBS for that monthly contact. But because Health Home Care Management is acting like an HCBS service, it must be done monthly on a face-to-face level. And so CES would not qualify. So children who go to CES, become HCBS eligible, and then CES assists them in getting family of one Medicaid, CES would have to instruct the family if there was no HCBS services that they could be connected to or that would meet the child or youth need, that they would have to go to Health Home. So this restriction really needs to be able to be explained to families. And it's really important to ensure that families understand that our goal, right, is if a child is HCBS eligible and has these high needs, that we are hoping that one of the HCBS services meets their needs and they're connected appropriately there, but care management is also an option because we do know some of these children need some Medicaid services like private duty nursing, or maybe now with children and family treatment support services, that may be a service they can now access because they're in Medicaid. But they would still need to become HCBS redetermined on an annual basis. So we've had that question. So all the HCBS rules still apply for a child who is family of one and only receiving care coordination, right? So they still need the annual recertification. They still need to meet whatever Medicaid eligibility on an annual or recert time period. They still need a monthly contact. It just happens to be now Health Home Care Management if they can't connect to another HCBS service or they don't need that type of service. So all the HCBS requirements are still in place because we received a lot of questions since the guidance has gone out. Now, anybody who's community eligible, care management cannot be their only HCBS service. So that is the distinction. So we have a great flow chart here for those who are visual learners. So a family of one child or youth, so we mentioned they would have the KK codes, and we do have a list of the KK codes we added to the slide deck to remind folks, who meets all the children's waiver, right, target, risk, and functional eligibility. They have a slot. They're Medicaid eligible, right, because they have that family of one. They can receive either Health Home service only and monthly, or they could receive an HCBS service monthly. And they would, of course, get care coordination. And for those children or youth who only receive HCBS service instead of just case management or care management, then they have the option to go to Health Home or to CES with, you know, their managed care plan coordinating services. So those children who are family of one and only getting care coordination, it must be Health Home. So that is the point of this flow chart right here, is to illustrate if you're a family of one getting only Health Home Care Management, it cannot be CES. Otherwise, the family would have options.
I wasn't going to say.
Oh, I thought you were going to say something.
Oh, you're doing great.
Okay. So as we mentioned, we were talking about disenrollment and, evaluating if that needs to happen or will happen for a child. And we want to make sure that people understand that enrollment in the waiver also has, as Wendy mentioned, it may have, I should say, have this direct link to their Medicaid eligibility. So if a child or youth no longer meets eligibility, or they say, you know what, we're not interested in HCBS anymore, we don't want care management, then the child who's community eligible, so that top box in the middle, and so they're not family of one and they don't have a KK code, they can be disenrolled from the waiver services because they still have Medicaid, because they're community Medicaid. They can continue to get other types of Medicaid services like CFTSS or private duty nursing or something like that. So that is not the challenge. The challenge is for those children who are family of one who have that KK code. If they're no longer eligible or they're not interested and they're disenrolled from the waiver, then they may lose their Medicaid. As Wendy said, they may have a large spend down or something like that that they can't meet. So that means if they have other Medicaid services like private duty nursing or CFTSS or something like that, they would also be disenrolled or lose those services because those are Medicaid services. So that is an important part, is that you need to know as a care manager that who are the children you're serving and what type of Medicaid that they have, because it allows you or doesn't allow you to do certain things. And you want to be able to make sure that you can explain this to the family. And again, we just want to highlight again the importance that we know during this transition that the providers have been trying very hard to meet all the different requirements and changes of their services, because many of the CFTSS services used to be in one of the waivers, one of the 6 waivers previously, and has changed somewhat to be state plan. And remember, our goal was a good goal, was to have children who were in Medicaid have easier access to these services and not have to meet the level of care determination. So we knew there was kids in Medicaid that needed these types of services but may not be a level of care kid. So we expanded the array of state plan services through CFTSS and CFCO so that children in Medicaid could access these services. But at the same time, during this transition, it has made some capacity issues that, we're trying to address. And I know the providers are working very hard to, move their programs along or rev their programs up. And so we want to just stress again the need for the care manager to evaluate the plan of care, the needs of the child, and if their needs can get met by state plan services, then maybe you should think about disenrolling them from the waiver services. We also want to highlight, though, once again, that if they're family of one and you're disenrolling them from waiver, they may lose their Medicaid and then they would lose their state plan services. So again, it's really important as a care manager for you to know whether or not the child you're serving is a family of one child or not through their K codes, and that you also understand that a family of one child can get care coordination only through the health home and then continue to get other Medicaid services. And then hopefully this is not too confusing for anyone, but we did try to walk through the options so people understand that if someone is in the waiver, and again, enrolled in a waiver means you meet target and level of care and risk, and you have a slot, and as Wendy mentioned, you may or may not be certified disabled, right? You can get that family of one while your disability certification is being completed, or you may already have SSI or disability determination, so that can move you right into the family of one. The child and youth who does not receive that HCBS service So if the child is not family of one, no KK code, then the child can be disenrolled and continue to have Medicaid services. If they're family of one and they receive health home, then the child continues to have their waiver services and their Medicaid. And if the child is family of one and does not receive health home and they're disenrolled, then they may lose their Medicaid. And again, I just want to highlight what Hope said. We're not asking you to pick and choose and move kids around. What we know during the transition and moving of services from waiver out to state plan, that everyone should, the care team and the care manager should look at the needs of the child and always try to match them to the appropriate services. If they need waiver and CFTSS or state plan services, then they should be connected to those services. If they don't need a service or they're not utilizing a service, because we have had that question several times, what do we do if they're not using the service, then you need to talk with the family and the care team about disenrolling them, and then obviously knowing the impact, if they're a family of one, of what that may do to their other waiver services if they lose that. So it's just important that you know those two things.
So along with that, if you're sitting down with the family and discussing why they're not using an HCBS service, recognizing now that there's an expanded array of HCBS services available in the children's waiver, and the family might not be aware of all of the services that are now available through HCBS. So if they are a family of one service, a family of one situation, and they need that monthly HCBS, there might be another option for them that is more in alignment with what their current needs are.
Great. Okay, and so I just mentioned, I added this back in because people, I think, are still a little confused. So when we say the diagnostic group, so that's a nice formal Medicaid thing. This is what Wendy was talking about. So when we're talking about the K4 and the K6, when we're talking about those medically frail diagnostic groups, then those are the K codes. And this is what our friends at the local departments of social services is talking about when they're talking about that group. And then on the next slide, we compared the old waiver codes to the new. And so I just want to highlight again that children should have more than one K code, right? So all children who are eligible should have a K1. Then their diagnostic group would then tell them where they fall based on their target population, right? And then our KK is the family of one. Great. So I hope we didn't go too fast. That was a lot of information. There is more information in the guidance documents to help you. And then we just have received a list of questions that we're hoping to answer in 1 minute. Okay. All right. So that's funny. All right. So after hospitalization, LPHA is required to remain in HCBS. So I just want to reiterate the process. So HCBS eligibility determination is due to make someone eligible for the waiver, and then it must be completed annually, redetermined on an annual basis, unless there's a significant life event. In the guidance document, we define what a significant life event is. In the UAS for HCBS, there is a list of what a significant life event is. And so if a child has a hospitalization, you may have to redo their HCBS eligibility, and part of that is an LPHA form for most of the target populations. So I just want to clarify that. So we received a question actually this week. The person said the child's HCBS and they went into the hospital on Friday and they got out of the hospital on Monday. So would I need to do an HCBS eligibility determination because I found out 2 weeks after the effect? So no. So we have defined a significant life event as when it's significantly impacting the functioning of a child or their parent, guardian, legally authorized representative. And so we go on in that definition. So if it was a stay during the weekend, it may not need another HCBS eligibility. But we're also referencing in this PowerPoint, right, and also in the guidance document, stays that are around 90 days or longer. So we're not talking about a day or two. But again, it really depends on why they were hospitalized and what was going on. It may need a new CANS, it may need a new HCBS. But the LPHA is part of the process based on the target population. So this question, Wendy, I think you can help us with is, why would a child lose their Medicaid while hospitalized simply because they are a family of one? Wouldn't they need their Medicaid then to receive care?
A child shouldn't lose their Medicaid, they shouldn't lose family of one when they're hospitalized or their Medicaid eligibility. So if I indicated that, I apologize, that's not accurate.
So I think this was raised when we were discussing family of one needing HCBS, and then they go into the hospital and they can't obtain HCBS because they're in a restricted setting. So something happens on the Medicaid eligibility side to continue their Medicaid in that scenario?
They're not being taken out of the waiver, right, for 90 days.
Correct.
So during that 90-day period, nothing would impact their Medicaid eligibility. They would stay family of one.
And then is there action that family needs to take post 90 days, like if the stay is longer than 90 days?
If through the Department of Health we get information indicating the child's no longer in the waiver, that information goes on to the local Department of Social Services, and it may impact the child's ongoing eligibility. It depends on their category. If they're a certified disabled child, it should have no change in their financial eligibility, because disabled children who are out of the house at least 30 days, we do not count parental income or resources, so that child would maintain basically a family of one eligibility determination. But if the child is not certified disabled, we would need to reconsider that child's financial eligibility. And for other categories of children who are institutionalized, we do still count family income. So it could impact their ongoing eligibility. I think also, though, if they're hospitalized and that may change or result in a disability determination, the child would now meet that disability determination. We would try to go down that path first to see if that child could now, maybe we didn't take them down that path before, we would go down that path first before ever negatively impacting the child's eligibility.
So what I would say for care managers, because that's a lot of information, is that if a child is in a facility who's in the HCBS Children's Waiver, prior to 90 days, we're saying their eligibility should not be impacted. If it's after 90 days, you're going to disenroll them from the waiver, but you're going to make sure that that hospital or residential facility is contacting you if they need services whenever they're going to be leaving. So, and hopefully they're doing that at least 30 days out. So the goal would be if little Johnny went into the hospital and you had to disenroll them from the waiver, and then 180 days later they're going to get discharged, you will hopefully be notified. You can do HCBS eligibility determination while they're in the hospital, right, and help with that discharge planning so that when they get out of the hospital, they can hopefully be re-enrolled in the waiver. So in the meantime, you'll know from what Wendy is saying that they may be losing their Medicaid or something may be changing with their Medicaid. So those things may happen. But the goal for the care manager is to try to make sure that they continue with their eligibility after 90 days if they do get discharged. So can you clarify if it's still the case that a child can remain Medicaid eligible if hospitalized for over 30 days under a 366?
Not familiar with that.
I'm not sure what it is.
Okay, so I'm not sure who sent in that. We're not really sure what that means under a 366. So if you want to send in that clarification, I think that would be helpful so we can try to answer your question. So if the child does not receive waiver services each month due to HCBS provider availability, if we just document in the notes that we continue to try to find a provider to accept the child and the provider and provide the service, can the child stay in the waiver? So yes. So right now, during this transition, we are trying our best to articulate that our goal is to try to meet that requirement. So the first thing is we're asking all care managers to reevaluate plans of care and make sure that if children are not utilizing a service or don't need a specific service, that they get disenrolled. Of course, mining the Medicaid eligibility of family of one so that we can maybe open up services for children that are waiting. And then we're connecting kids to the right services through this transition. But please follow the rest of the directions where you're calling your managed care plan, you're calling the rest of the providers who are designated in that community, and you're talking to your lead health home who will notify DOH. We are working with stakeholders to try to look at qualifications and other things that are happening with providers to try to open up some services. We don't really have an understanding, I would say, at the state level of how many children have no services and are waiting. So my goal here is that we don't have all these children discharged or off of waiver, right? So we don't want a family to go through that. I would hope that if you can't connect them to an HCBS service, you are connecting them to other Medicaid or other community services to try to meet their needs, because you're still responsible to make sure of their wellness and safety and that they have the supportive services in place based upon your needs assessment. So if a child is in care management and currently residing in a rapid intervention center, in order for them to assess current needs, is that a restricted setting that prevents care management billing if we are still working with the child and family? I don't know what that is. Okay, so we're going to have to get back to you. We're going to have to look into what a rapid intervention center is so that we can answer that correctly for you. For children who are DDMF or DD foster care, is the HCBS eligibility redetermination for the next year due by the date of the LCED or the date the DDRO enters the child in the UAS? Okay, the annual redetermination for all children, regardless of target population, is when the outcomes is signed and finalized in the UAS for the HCBS eligibility determination. It actually says at the top of the page that the calculation cannot start for the annual redetermination until it's signed and finalized. So if your DDRO is going in and doing that, they have to click the proper buttons and sign to start the clock, and then you as a care manager can go into the UAS and see when that started, okay? There's also a report that you can print out to know when your annual determinations are due. So you could run that monthly or whatever, and you could stay on top of it. But this annual redetermination does not have any connection to the LCED. It may, because the LCED is renewed every year, so you had to have that to get HCBS, but it may be off some time frame depending on when things were done or completed. So we have some transitional clients who still have active HCBS but no longer need HCBS. However, they will lose Medicaid if they discontinue HCBS and thus lose CFTSS that they really need. Do we need to discontinue these clients because they are not in need of HCBS? So the answer to that question is it's dependent upon their Medicaid. So if they're community eligible, you want to disenroll them from HCBS if they're not wanting it, and they can continue with their CFTSS. You want to notify capacity management and give them the notice of decision and do all that good stuff. I'm assuming these are children who are family of one because you're mentioning they'll lose their Medicaid. Then that is a discussion you need to have with the family to educate them that they would lose their services. So as we just mentioned, family of one children who don't need any of the HCBS services can have care coordination on a monthly basis that counts as HCBS. Just remember you need to provide that monthly service regardless of acuity. So that's really important. And then they could continue with their CFTSS services. But they need to be an HCBS waiver, and all the requirements for HCBS are the same. You must meet those requirements to keep them in waiver. Can you please comment on the annual Medicaid recertification documentation requirements for family of one children? In the recent Children's Waiver ADM, it said that Medicaid recert processes were not changing, but requiring proof of all family members' incomes resources is changed. Can families opt out of providing income resources at the time of the annual renewal?
I think I can answer that, Colette. At recert, we are requiring parental information, not proof, in order to continue a family of one budget, because we, again, every year have to look first to make sure that that child is not eligible based on a family budget. So we will be asking at recert for the family information, not proof, in order to do that Medicaid eligibility recertification. If, and I'll just say if, the child is eligible based on family income, that is when we will require proof of the parental income.
But that would be a good thing, right? So a child who's family of one and their recert happens and the family's financial situation has changed, that the family might be able to be on Medicaid. Now the other children in the family could benefit from Medicaid services, correct?
Yeah, that would be the case, yeah.
So I think that's important for folks to know, that there may be this opportunity that if a family situation really changes where they need to all be on Medicaid, that there's that option, and then that child would no longer be family of one, and now they have the option of all the Medicaid services, whether HCBS or not.
Correct. And this is a change from how some of the other individual waivers have operated at recert. So I'm actually glad the question came up so that we could clarify that. We are requiring parental information at recert, and that is a change for some of the waiver programs.
Right.
And that just goes back to the hierarchy that CMS instructed us to follow before landing on an eligibility budget for a child. We have to go through this hierarchy and can only end up with a family of one budget after we've tried to make the child eligible under these other budget calculations. So we need to demonstrate that each year, which is why the information is being asked at each recertification.
Right. In the OPWDD system, parental income was never considered when a child needed services. Medicaid waiver was always determined based on eligibility of the services first and foremost, and the waiver allowed for the necessary services at no cost to the family. I'm not sure if that's really a question, but I just also want to say that so the process is the same. You need to determine if they're HCBS eligible, and then that is utilized or shared with the local district. I don't know, do you have anything to add?
No, other than there was a lot of communication because of where we had to obtain some of the authority for different parts of this with CMS, and it included certainly on our side of the house, the eligibility side, financial eligibility side. We had several conversations with CMS and their eligibility experts, and it has clarified and changed some things in how the individual waivers had been operating. So you will see some differences, but this is under the advisement and instruction of CMS that our children's waiver is operating, at least for financial Medicaid eligibility, in this manner.
So somebody's asking you a question specifically from Wendy. How is sibling income deemable or counted towards the child's benefit once the parental income is above or allowable amount already and would otherwise require parental deeming of income?
All right, I think I can answer that. When we do an eligibility determination for a disabled child, as part of when we put in that parental income, that is when we're adding in any income of non-disabled siblings, and we are using it in the process of determining eligibility. Doesn't mean it's all going in a pot and it's all counted towards a disabled child. It's being factored in. So when we look to see if we're going to set aside some income of the parents to meet the needs of the non-disabled children, we need to know what income those non-disabled children may have of their own, because that means they will get less income allocated from their parents to meet their needs if they have their own income. You know, child support from another parent, something of that nature. So that is why how siblings' income information gets factored in. It's not as if it's counted, but it does get factored in. And this is what, when we go through an eligibility determination for a disabled child.
Okay, there's more for you, Wendy. Once a child obtains Medicaid through the family of one for SED, does it cover everything or does it just pay for HCBS services? Everything.
Once a child's determined eligible, and eligible due to participation in the waiver or not, but they're Medicaid eligible, they're eligible for the full array of Medicaid services.
How do you change the status of medically fragile child who is currently receiving Medicaid due to family income but doesn't have the medically fragile status in place? I don't know if I understand that.
Is that saying that their status is certified disabled, but they really don't have a certification of disability?
So we received a question that was similar to this in the past, where we talk about children who are medically fragile, but they're not participating in the waiver. They're community Medicaid, they're enrolled in plan, they're medically fragile children, but they're not participating in the children's waiver. And we wanted to make it clear that you do not need to participate in the children's waiver to access services. If you have community Medicaid, you can access PDN, you can access any of the state plan services. You would only participate in the waiver if the family needed an HCBS service that is only available through that waiver. So that brings us back to what Colette has been saying, several times in this presentation, that we really want to look at, through that person-centered process, sitting down with the family and understanding what that family's needs are and how to best meet those needs and what path to take based on those needs.
And if that isn't the question, please try to ask us again, and we'll try to respond.
So we have a child who's eligible for Medicaid based on the parental income, so not family of one, and had it via the marketplace. After we received the LOC HCBS eligibility for her, the family received a notice from the county that they needed to complete forms via the county now due to her needing waiver services. Should we be telling the family who already received Medicaid to expect this to happen?
That's not right. The district didn't act appropriately in that place.
Did you think it was part of the? We're having a sidebar on that. Just one sec. I think it's important to mention through this question that if a child has Medicaid through New York State Health, as part of along with their family, and they then become eligible for and enroll in the waiver, we are going to move that child's Medicaid from New York State Health over to the local Department of Social Services on our WMS system, because that's where that child can be better tracked along with their annual, not that the district needs it, but to be able to respond better to their enrollment in or out of the waiver. That child's case is moved to the district, so when they need to determine eligibility, they will receive a recertification, the family, from the local Department of Social Services.
So we're almost out of time, and there is still a batch of questions. I want to just reiterate that the slide deck will go out. It will be posted on the MCTAC slide website. It's recorded, so folks who have not participated today can listen. And we will do an FAQ, and we've been sort of timely with those, so we'll try to get that out. The other thing is there's a number of questions regarding the K code. So I just want to highlight this if it was not clear. So the K codes are now put up by DOH here or the local district, depending on if the case has come through Health Home or through CS, but it's no longer a requirement for the care manager to send things to the local district or prove that the child's in the waiver. And after you complete the HCBS LOC, I would say that we're putting the K codes up within a day or two or three, I'll say a week. But we have been, I wouldn't say week because I'm not doing anything, but our eligibility staff have been turning that around pretty quickly. And if someone's having a problem that they don't see a K code after some time, please reach out to the Health Home team or the Behavioral Health Transition mailbox, and we will investigate why a K code is not up to try to assist you. And that is the same for KK. So what happens with KK is those children would go through CS right? And the local district would do all those fine steps that Wendy outlined to determine whether or not and how they would get Medicaid. And if they're a family of one, then once that's determined, the local district puts the KK up. So it should be a pretty short turnaround. But, you know, these are all new processes, so if you're having problems or concerns, please reach out to us so that we can address them. I really appreciate everyone attending. As we mentioned in the slide decks, it does highlight where on our website, so these documents are, because that's been asked a couple times, and they're also in the PowerPoint. And I just want to thank everyone that's in the room, especially Hope and Wendy and our eligibility staff and Tanya and Margaret and everyone who's been helping us, and appreciate all the stakeholders and providers that are doing their very best through this transition. And we hope that this has been helpful to address a number of questions and needs in the work that you do. So have a wonderful Halloween. Stay safe. Caitlin, do you?
Yes, thank you everyone for joining, and enjoy the rest of your day.